And let me try to answer that. First of all, there's no mandate from the state in regard to purple. There's some guidance, and we tell people it's a heightened level of awareness, a heightened level of concern. But we always tell people to look at two things. Look at your color, but also look at number of cases per 100,000. And you can see it every week. And that'll give you some idea how you compare to other counties. For example, Cuyahoga County, the other end of the state, John, their numbers, they're way down the list. I think they're barely high incident level. That's high. But there's 70 other counties that have more spread than they do. So look at where you are, number of cases per 100,000 in the last 2 weeks. That really kind of tells you what your odds are of running into somebody who's got it. And that's kind of the way I would look at that. So that's important. The color code is 7 different potential indicators kind of come together to tell you overall where you are. And some of those indicators are early warning indicators, and some of them are late indicators. For example, hospital. More and more people coming into that hospital. The 3 counties that we put on the watch list all would qualify this week as purple. But our system says you got to, from all the information I can get, are doing a very good job. The indicators are that we are not seeing a significant amount of spread in the schools themselves. And it goes back to what I've said, that what we've learned. What we've learned is when people are in a more formal setting, factory, workplace, school, people follow protocols, and they wear masks. They try to keep a distance as much as possible, and we don't see a lot of spread generally. So that would be true with the schools as it will be for in business. Same way with colleges. In classroom, we don't have an indication there's much spread in the classroom. Spread in the dorms where the school can control the situation. There's some, but we're really seeing the spread throughout society is just people letting their guard down, the examples I gave earlier today, and just this social interaction and spread, people not wearing masks, not being careful, not keeping a distance. So I would ask our educators, I would ask our superintendents, take all that into consideration, in the same way with parents. I think you also have to add the fact that while some students will thrive no matter how they're taught, it would seem, there are many students who don't. And there are students who don't thrive in a remote learning situation. And so we are now seeing some schools that were went remote, of course, in the spring. They've come back and were remote up until now. Some of them are announcing that they're going to stay remote at least until the end of this calendar year. And I would just say, look, we believe in local control. We believe in schools and parents making these decisions. But I'm bothered as the governor, frankly, by schools, by kids being out of school that long. And this is, again, an individual decision, but I think that everybody needs to, we continue to learn more. We're going to do a study, but the results of that study it'll take a month, but we're going to go into some schools with the school's consent and individuals' consent, obviously families. And if, let's say, Mary is in a classroom and it's found out later she has COVID, and they look back and say, well, she had Billy over here and he was within 4 feet of her. for longer than 15 minutes, and he's got to be quarantined. And that's what the CDC says. What we're going to do for schools that, if we can do this trial, and we intend to do this trial with new quick tests, we're going to allow that student who is close to the other student to stay in school, but to test them and test them very frequently. At the same time, we're going to take another group of people in that school, another group of students in that school, and again with parents' consent, everyone's consent, and test them even though they've not been exposed. And we're going to see what kind of numbers that we see. Because anecdotally, which is all we have now, we are just not seeing a lot of spread directly in the classroom. And when you go up on the where kids have been out of school for some period of time, I think they all need to take all these factors into consideration in deciding, what they need to do going forward. And I apologize for a long answer, but it's a complex issue. We've left it to the local community to make this decision. Part of my job, I think, is to give the local community as much information as I can. And some of the new information that we're getting as we just kind of look at this anecdotally from schools is that schools, like most other things in society that are more formal, there's not as much spread as there is when people are just kind of getting together very informally.